A young mother, a heart murmur, two sisters dead before 30. What's the diagnosis?
Welcome to Clinical Pearls in Practice. Today's case, a 25-year-old postpartum woman with an asymptomatic systolic murmur, first noted at age 20.
Here's the critical finding. The murmur increases with Valsalva. That's the opposite of what most murmurs do, and it's a classic sign of hypertrophic cardiomyopathy.
Then she reveals her family history. Two sisters died suddenly from cardiac problems in their early 20s. That seals it.
Hypertrophic cardiomyopathy, or HCM, is the most common cardiomyopathy, 1 in 500 people. It's autosomal dominant, causing left ventricular hypertrophy without chamber dilatation.
Why does Valsalva make it louder? Decreased preload means less blood in the ventricle, so the thickened walls obstruct flow more, intensifying the murmur.
The biggest concern? HCM is the leading cause of sudden cardiac death in young athletes. She needs an echo, genetic counseling, and careful risk stratification.
Clinical Pearl, systolic murmur, louder with Valsalva, plus family history of sudden death equals hypertrophic cardiomyopathy until proven otherwise.
Thanks for listening to Clinical Pearls in Practice.